A Foley catheter is a type of catheter that has a balloon on the inside. Like other types, the tube is inserted into the urethra through to the bladder. Once the tube reaches the bladder, a syringe with water is attached to one of the two lumens, and it inflates the balloon to keep the catheter in place. Knowing this procedure, you can put in contact with fluids, therefore it is a sterile procedure. The next few images are some examples of Foley catheters. Once the catheter is inserted, you need to follow the proper care instructions. One of the most important things is to assess. One thing would be the color. It should be straw colored. Clarity should be clear with nothing floating. The amount should be 30 milliliters an hour, and you should always assess the odor, if it's strong or if there's no smell. Always ensure it is draining properly into the bag. If not, look for kinks in the tubing as the client may be sitting on it. Always ensure the bag is below the bladder level to prevent backflow. When you prevent this, you prevent infection. You need to make sure it is safely anchored so the bag doesn't get heavy and pull the tubing, because this can cause pain to the client. As well, emptying the bag every 8 hours is important, or when it is full. This also helps prevent any issues. Providing peri-care at least 2 times a day or more is also important to prevent infection. The next few images are examples of catheter and proper bag placement. The last image was a leg bag. These are used so clients are able to go out in public and keep their catheter and bag discreet. When the client is getting ready to leave the hospital, it is important to teach them how to care for the bag and how to make sure it is properly attached. When doing this, ensure the client does a teach back so they fully understand. When you're teaching them, explain to them that when the bag gets full, they must empty it, or they need to empty it every 8 hours. How to properly empty the catheter bag or leg bag. First, you must perform hand hygiene. Then you explain to the patient what will be going on, and you always provide privacy by closing the curtain. We then apply gloves, place flat pad under the drainage bag, sit the collection hat on the pad, open clamp to allow urine to drain into the collection hat. Do not let the clamp touch anything, as this is cross-contamination. Close clamp once done and replace drain into a holder of the bag. There's normally a little spot for it. Always chart the amount, appearance, and odor, especially if there's any discrepancies. Place on flat surface and measure at eye level. Empty into the toilet. Then you clean and store collection hat in appropriate area. Remove gloves, hand hygiene, and record. And that's all. Lastly, we will go over the removal of a catheter. This requires a doctor's order, and you always double check the order before you do anything. Post-removal, you must keep input and output record for 24 to 48 hours. For this, you will need gloves, a large blue pad, a 10 ml syringe, that's to remove the balloon. First, attach the syringe to one of the 2 lumens and remove the water from the balloon. Then, tell patient to take a deep breath, count to 3, then remove quickly. Once removed, measure urine and drainage bag and record the output. It's as simple as that. You also need to make sure you ask the patient if there is any discomfort, because that will need charted as well. First, I'm going to start with the female demonstration. So before we do any contact with the patient ever, we always do hand hygiene. Okay, so as a PSW student, I am not able to insert catheters, but I can go over all the parts of a catheter, and I can also go over how to remove it. So first I'm going to start with explaining the necessary equipment we'll need. Obviously, since I'm at home, there's only so much I could find. So, move my model. So right here, I have my collection bag, and it has the milliliters on it. And as we can see, this client has already put urine out for me today that we can measure. This black piece here is the clamp. So right now the clamp's open, so urine can flow freely into the bag. Here we have our 2 lumens where the hoses, the tubes, would connect. So this one is used, that's kind of hard to see, this one here is used to inflate the balloon. And then we get into the body parts. Okay. So here we have our catheter piece inserted into the vagina. And we'll put that down. And then we can see that this piece here is the bladder. So in the bladder we have the balloon. And I did it like this, it'd be easier to see, but because there's a balloon in there, it can't, the catheter can't be pulled out. So set all the equipment down. So if we were to be draining the urine bag, we would take our second clamp and there would normally be a little hose in the corner that would be clamped up like that. I would unclamp it and let it drain into a collection cup. Once all the urine was in the collection cup, I would then put it back up and clamp it shut. So I'll lay that back down. Make sure it's all connected. So the next portion that I will talk about is if I were to need a specimen collection. So when you collect a specimen, you cannot collect it out of the urine bag. That's because we have no way of telling how long that's been there, and it's better to get a fresh sample. So what I would do is I would take a syringe. Well, first I would clamp. Always clamp. So I would take one of my extra clamps and clamp before the urine bag. So it's clamped right there, so urine will collect here. Then I'll come up to this lumen, this one, with my syringe, and I would take it, I would fill it up. Normally we need 60 milliliters, so I may use a 30 ml syringe, and I'll probably use it twice. Put it in a collection cup, ensuring that the syringe doesn't touch any of the sides of the cup. So once we do that, we make sure that's closed, take the syringe off, and we can unclamp and let urine flow freely again. So to remove it, it's a little bit of a process. We would ensure no urine, and then we would unconnect the hose from this lumen. So then it was just a catheter. So we would have all the extra equipment put on our blue pad, which this is what I have here as a pad. So we'd set that all aside. And now we need to deflate our balloon. So in my case, I'm just going to set it aside. And then we would pull through. And then just like that, our catheter's out and the vagina and the bladder can work as they regularly would. Now we're going to go in our process over with a male patient. So first, as I did with the female, hand hygiene. Okay, so I will go over the equipment again, just as the setup's a little bit different, as male and females have different body parts, just so everybody understands what it would look like with a male. So same idea, we have our collection bag here, and it has urine in it with milliliters, so that measures how much urine. We have the hose going into the bag, and then up here we have our 2 lumens, the one that comes out and collects to the hose that goes in the bag, and the one here that would be used to fill the balloon with water to hold it in place. So as we go through, here's our penis, and the catheter is inserted through the urethra, through, same concept, through here to the bladder where the balloon is. So something I want to go over now is the urine. So when we have urine, we have to always assess it. Color, clarity, and odor. So the color of this urine looks really well. I'm sure it's hard to tell, but it's a straw colored. It's not too dark, not too light. There's minimal odor to it, as there should be, and there's no sediment floating around in it. As well, the amount is really well for 2 hours. Okay, so I'll hook that back up. Okay, now we'll go over how to remove it from the male patient. First, we will ensure there's no urine, as always. Disconnect this piece here. So we have that hose disconnected, and we set our urine aside because we will need to chart that later and measure it. So what we need to do is we need to deflate our balloon, which I would have already done, through this port. In this case, I set the balloon aside. And then to remove it, this goes for the female as well. You want to tell your patient to take a deep breath and then count to 3 and do it quickly to minimize the pain. 1, 2, 3, removed, just like that. And our patient is able to void freely again, just as they regularly would. Thank you. I hope this video has been very helpful and educational as far as going over the concepts of catheters. Thank you.